Hi everyone, I'm Kara Sundlin, and Katie Couric just announced on social media that she is now battling breast cancer, and that this was discovered by a screening that she was 6 months late for. I am joined now by Dr. Alex Merkulov, a breast cancer radiologist at UConn Health, with more on what we all can learn from this. Doctor, thanks for being with us.
Thank you for having me.
So, this is something that Katie Couric thankfully, she's raising awareness, but I imagine there are a lot of women out there who are behind on the screening since the pandemic.
That is correct. So women typically fall into three categories. Those that get routine mammography for screening every year, they show up and every year they have a mammogram. Then there's some women that have mammography only when they see their primary care doctor, sporadically once every few years. And then there are women who never have a screening mammography simply because they're afraid, they think that it may be a waste of time. And so as a result, we really encourage everyone to come in and have their screening mammogram every year.
So Katie Couric said she shudders to think what would have happened if she was another 6 months late. I think somebody might say, 6 months late, is that even a big deal? What can happen in 6 months?
Well, it's definitely a big deal. So every week, my colleagues and I see breast cancer patients here at UConn who do not feel a lump in their breast, and the breast cancer is only caught on the screening mammogram. Now, this is the cancer that's at its earliest stage, and typically within 6 months, that probably could be effectively treated without needing any advanced surgery. If you don't treat that cancer and catch it early, cancer doubles in volume every 1.4 years. So if you don't have your mammogram this year, all of a sudden you wait 2 years, that cancer could be literally twice as large and much harder to treat.
Wow, so time really does matter, really does matter.
Absolutely.
And as far as self breast examinations, we used to hear a lot about that. I know we still do it to some extent, but how often should women be doing that?
So typically, a woman should do a breast exam once a month. She should pick a day, first of, for example, the first day of the month to do it. For the first 6 months, when she does her exam, she should not sort of raise any alarms until she learns how her breasts normally feel. But after that, because she knows her body best, if she notices any change in her breast health, she should immediately report it to her primary care doctor or to her OBGYN, and then we'll order additional tests.
Yeah, there's Katie Couric mentioned that she does not have a family history and that she was surprised when she found out she had breast cancer, but she did more research and found there's a huge percentage of women who have no history who end up with that diagnosis of breast cancer.
You're exactly correct. So believe it or not, 70%, so 7 in 10 women make the history for their family. They're the first woman in their family to have breast cancer. So basically, the main risk factor for having breast cancer is simply being a woman. And if you do not have a family history, you simply want to have your mammograms every year just to get it caught early if bad luck happens to strike.
And also in Connecticut, I know we have some laws that protect us where if a woman has quote unquote dense breasts, she should automatically be given an ultrasound. Can you talk a little bit about that and what women need to know so they can advocate for themselves?
Absolutely. So by law, we have to report to the woman what her breast density is on the mammogram. In Connecticut, we are very progressive, and as a result, we offer screening breast ultrasound as a supplemental test. So if a woman knows that she has dense breasts, which she will be informed about, she should most certainly have at least one dense breast screening ultrasound to use as a baseline. Some women get one of these exams every year, and what this does is it's a supplementary test that picks up cancers that sometimes may not be seen on a mammogram because even mammography has certain limitations.
And what's the average age of a breast cancer diagnosis?
That's a great question. So, in the state of Connecticut at UConn, we see about 25% of our patients are diagnosed with breast cancer under the age of 50. So, these are very important people to catch because they have many, many years to go. But typically, the majority of patients are diagnosed over the age of 50.
It, I've heard that the younger you are diagnosed with breast cancer, likely the more aggressive the cancer is.
That could be true. But in addition to that, remember, if you're 35 or 40 and you have breast cancer, the doctors are going to work to give you 40 years of life. Okay. So we're much more aggressive to get you more time. But it's true. The personality of the cancer also matters. Some women have a benign cancer, which is typically found in elderly people.
And let's cut through the confusion on when you should be getting your first mammogram. We hear a lot at 40. It used to say 50. Then there's the question, do you have family history? So I do think women sometimes get confused about when they can go and when it will be covered for them.
Understood. So basically, it's always a discussion. So right now, we really like to tailor your screening needs to your personal history. So usually women meet with the primary care doctor, explain, discuss their family history, and most women are at average risk, and so they should start at 40 years of age and have a mammogram once a year. Some women who are at higher risk may determine to have a mammogram earlier at 35, but in reality, really 40 is a good number to start with. And just once a year, and it's covered by insurance, it really will not cost you almost anything, in fact.
Are there known things that we could stop doing that will prevent breast cancer? Are there some things that we can do just to make sure that we have less of a risk?
You ask a great question. So this is one of my, personal areas of expertise. The most important thing you can do is, number one, do a breast exam, and if you notice a problem, report it, because that's going to draw attention to that area. But number two, you really want to manage your diet. Okay, obesity is a serious problem, and what it does is it's linked to not only breast cancer but numerous cancers. And as a result, maintaining your weight, controlling your weight, taking in high density nutritious food is the most important thing that you could do for your health, other than screening, mammograms, and breast exams.
And exercise?
Exercise always helps, absolutely.
Yeah. Any kind of supplements? People get all kinds of questions about the best supplements or things like that. I know nutrition is number one, but are there any studies that say certain supplements could really help us?
You're asking another great question. So here's the thing. The body is very sophisticated. If you feed it high density, high quality food, okay, fruits and vegetables, it will plug out everything it needs to be as functional and have the strongest immune system as possible. What people shouldn't do is eat, McDonald's for lunch, some kind of low density food for dinner, and then all of a sudden take a supplement with a lot of vitamins to think that they're all of a sudden healthy. The key is every day, just try to maintain your health by asking themselves, am I consuming something high in nutrition density? And if so, when can I start?
Yeah, yeah. And people, obviously you want people to be quitting smoking. That's a given. We won't spend too much time on that. There's a lot of controversy about alcohol. Is alcohol a problem?
So the answer is, if you consume a glass of wine a day, it's not going to affect you. Obviously, high levels of alcohol consumption are linked to multiple problems, and there is data that shows that it could increase your chance of breast cancer. But really, think about it this way. You do not know what you're sensitive to. So as a result, if you're someone who's sensitive to smoking, if you smoke, you will develop a problem, okay? Certain people, for example, smoke for 60 years and never develop anything. Certain people have 3 cigarettes and all of a sudden they have cancer at 37 years of age. So really, it's environmental exposure, such as avoid smoking, minimize or keep alcohol consumption to a reasonable level, and really take in high quality food, because your body knows what to do with it once you feed it the high quality nutrition.
Yeah. If you want to make sure you're getting screened, I know you are out of UConn Health.
Yep.
This is something that, there's always confusion about people who don't have insurance and people who do. We don't want that to be a barrier to getting a mammogram. If you have insurance, I don't know any plan that doesn't at least cover, once you're of that age, you get that, they want you to get that screening, and it's not going to be any cost to you. What's the best way to make sure you get in there sooner rather than later, and know that it's not going to be a financial hardship?
So it's a very good question. So UConn offers self-scheduling screening mammography. You do not need to see your doctor. You simply go on our website, book an appointment, walk in. Almost certainly, Medicare or your insurance will pay for it, and you don't have to pay anything up front, and it's a very inexpensive exam. So it's absolutely worth it.
So even if for some reason you had a copay or you do have zero insurance and you're paying out of pocket, it's not an expensive test.
No, it's even if you're paying out of pocket, it's going to be under $150, but
Okay.
almost nobody pays out of pocket. It's a very inexpensive exam.
Yeah, it's one of those things that really the system is set up to make you get it and get it for free. Anything else that you really want to get out there so that people can do what they need to do and get back into getting their screenings?
Well, put the fear away. October is coming up, Breast Health Awareness Month. Please come in and have your mammogram and hopefully do so every 12 months.
Yes, I got my reminder. This is my personal tip. After you get that mammogram, set the appointment for next year when you're there, because you're going to forget to call and you might miss the card in the mail. But I got my reminder that I'm supposed to go next week, so I didn't have to think about it. I forgot it was scheduled, but it's there. And after Katie Couric, I say I was about to reschedule it because I had something else. And the important thing is we should probably go to the mammogram and reschedule the other thing. So keep your appointments.
Exactly right. And we love giving you good news. Most of the time, it's just completely normal.
Yes, that is true. I know some people are afraid to go, but it's always going to be better to catch things early and a lot less scary than not going.
Exactly right.
Doctor, thank you so much for sharing your time with us today.
Thank you so much. Have a nice day.
You too.